Good morning, everyone. So nice to see so many of you in person. I've been doing a few presentations over the last fortnight, and I think, yeah, it's just been way better being able to see faces and not just talking to my screen all the time. So, and big hello to everyone online who couldn't be here today. But thank you for inviting me to speak today, and I'm really happy to talk to you about my main research focus that I've been working on for past 8 years now, and we're finally starting to get some interesting data through. So I thought it would be a good time to share that with all of my wonderful colleagues here. Before I start, I'd just like to make acknowledgement to country, acknowledging the traditional owners and their custodianship of the lands that we're meeting from here today and broadcasting from. I pay respect to their ancestors and their descendants, whose valuable cultural and spiritual connections remain with country, and we recognise their contributions to a global society as well. I just want to make acknowledgement of the numerous partners that we work with in order to do this work. So I'm part of a team based here at the University of Queensland and also at the University of South Australia, and we've had wonderful support from various government institutions like Safe Work SA, the Nursing and Midwifery Branch, Corrections, Safe Work New South Wales, WorkSafe Victoria. So big thanks to all of them. So this phenomenon of workplace bullying is all too common. It seems like every second day we're hearing from victims, from witnesses, from their families who are really impacted by these negative interactions. And it's a problem that organisations just don't seem to be able to get on top of. They're not handling it particularly well. So claims of harassment don't, just go uninvestigated, or they're sometimes even used against complainants and to negatively affect them. And even in organisations where these matters are taken seriously, the measures used to try and prevent and intervene in these behaviours can be ineffective and lacking, and sometimes we see our victims pay the ultimate price for this. Now, we believe that the key to addressing this issue better lies in education and understanding how bullying presents in organisations and what truly underpins these kinds of behaviours. So just to start, some basic assumptions around workplace bullying. Defined in the legislative legislative sense around repeated unreasonable behaviour that creates a risk to health and safety. In the academic literature, we tend to refer it as repeated systematic behaviour over a period of time where there is a power imbalance. We have compared those two definitions in research and find that prevalence rates don't tend to vary very much. So it doesn't matter how you're sort of defining it, it's still affecting about 1 in 10 Australian workers. On last count in 2015, we feel pretty positive that that number's gone up since our last sort of major research on this. There's some pretty reliable evidence that bullying has a really harmful effect, not just on individuals, but we're starting to see emerging literature on bystanders as well and how it affects them, and also the organisation as a whole, and indeed actually, a global society. It's still been somewhat difficult to ascertain these accurate prevalence rates for bullying. Even though we have these clear definitions, it's the way organisations measure it and that sort of thing is still quite inconsistent and lacking. So in 2011, the Asia Pacific Centre for Work Health and Safety at the University of South Australia launched an innovative new project called the Australian Workplace Barometer, or AWB. And that provides a evidence-driven sort of, project around work conditions, relationships to workplace health and safety, productivity through a national monitoring and surveillance system. To date, there's been 4 rounds of data collection. So I think the most recent was in 2017. They've collected data from tens of thousands of participants around Australia, so all states and territories now. And it does provide very reliable evidence relating to psychosocial risk factors and the working population, and an analysis between these kinds of things. So from this data, we've been able to establish pretty reliable national representative data on where bullying is experienced. Sorry, I'm a little bit out of breath of someone kicking me from the inside this time. What might be unsurprising to some of you is that bullying tends to present most commonly in health and community services, in education, in personal and other services. So that's things like hairdressing, florists, beauty services, that sort of thing. Also some high rates in things like retail and, not retail, transport and storage and construction. So, but, pretty prevalent across most industries in Australia. There's not a lot of evidence about differences in bullying between the public and private sector in Australia. Bit of a recent snapshot from employee culture surveys. So in the public sector particularly, shows a pretty severe problem. So rates as high as 35% in various sort of health state jurisdictions being exposed to bullying in the last 12 months, and that's well above the Australian average of about 10%. The effects of bullying quite well established, so over 40 years of research have yielded this really clear picture of the short and long-term effects of exposure to bullying as a target, also as a witness. This highly cited meta-analysis, shows psychological impacts around mental health problems, absenteeism, burnout, PTSD, also physical manifestations, poor sleep, headaches, cardiovascular disease, and then obviously implications for the organisation around lower job satisfaction, lower commitment, intention to leave, all of that sort of thing. So it's a wide array of consequences. Evidence from longitudinal studies shows that there is this lagged relationship between bullying and mental health. So obviously bullying, causes poor mental health, but we also have seen a reversed lag effect there. So those with mental health are also more likely to experience and report workplace bullying. We have a couple of hypotheses why that might be the case. And we've also obviously seen a lagged effect of bullying on absenteeism, and I'll talk a little bit more about that later. At a societal level, if we compare the frequency rate of workers' compensation claims for mental stress as a whole, this has actually been going down since 2002, or it was until recently. So that was a nice steady decline. But over that same period, we saw claims specifically for workplace harassment and bullying increase, so up to about 17.5% in 2018 and 19. Again, I think that will have risen just in the last 2 years with all of the disruption that COVID has caused to workplaces. We know that per claim, the median payout for bullying claims is around 11 times greater than for other mental health stress claims. And the median time lost from work is 18 times greater than for your average, injury sustained at work. So it's quite a severe problem and has very, very, ongoing implications. It's not a problem that's gone unnoticed by organisations. I'm sure, you've all been in workplaces where you've seen some kind of preventative, interventive measure gone in. The ones in pink are probably the ones you've noticed most often. So those are things like educating workers around bullying, setting up reporting mechanisms, maybe a policy, code of conduct about how you should behave, being told to behave appropriately. We've heard in some instances of people having to sign a contract saying that they will behave appropriately when they come to work. The problem with these kind of approaches is that they tend to sit at what we call the individual level. So they're very much a focus on individuals doing the right thing, adhering, just being nice to one another, essentially. So behave appropriately, defend themselves from the perpetrator, report bullying when it occurs, also manage the effects that come from bullying. So, go and have counselling, go to yoga, go and do some meditation, because those really severe sustained effects of bullying is obviously going to be treated by half an hour on the yoga mat. So yeah, deep breathing, but also go and confront your CEO who's bullying you about your work contract or something, because that will definitely address the issue. Obviously it doesn't. We know that being exposed to workplace bullying brings about those negative consequences. In this study we looked at in 2014, we found about a sort of loss spiral of effects. So exposure to workplace bullying resulted in increased levels of emotional exhaustion. And without having that sort of vigour and, you know, ability to recuperate, we found that people were experiencing reduced personal and job-related resources, specifically related to co-worker support and supervisor support. So they weren't able to sustain and maintain their relationships with their colleagues when they were at work. And this is a pretty well-known protective factor against something like bullying. But if you're just so emotionally drained from what's going on, from the behaviour that's being, you know, you're being subject to, and you're not getting that support from colleagues, you in turn don't want to, you know, sustain those relationships, which leads to even more workplace bullying. And that, you know, just continues usually until the person leaves the organisation or gets transferred to a different unit, or any number of sort of consequences from that. We also know from the broader literature that the best interventions to tackle this problem are not at the individual level. So at the time of this study, 2014, and I really don't think there's been much done since then, there's only 12 published studies on, you know, bullying interventions in the literature. It's sort of something that's done and thought about a lot in practice and very, very rarely addressed in the academic literature. What this study found was, from those 12 studies, only 3 were of moderate methodological quality, 9 were low, and then only 2 were really effective in addressing, addressing that kind of problem. So those other boxes should be in blue. So the key to note there is that the only 2 effective interventions that were deemed effective were at this organisational system multi-layered focus. So these are the CREW studies, Civility, Respect and Engagement at Work, from who was established by Michael Leiter at Deakin University in Victoria. And they involved a series of weekly team meetings over 6 months, where they sort of established what was going right in the team, what was not working so well, and then taking steps to try and increase positive experiences and reduce negative. Sustained effects in a year follow-up, but there was some suggestion that that would wane over time because they didn't continue those weekly meetings after that intervention period. And also very time and resource intense to bring the whole crew onto, off the floor for an hour a week for 6 months. So very, not necessarily so sustainable. The other issue with these interventions is they're actually based on incivility, not bullying. Incivility sits at the lower end of the spectrum in terms of negative workplace behaviour. So although it has some negative impacts, it's not quite as, it hasn't escalated to the point of bullying. So the impacts on individuals and organisations are not quite as great. So we're not sure if this kind of approach would necessarily translate into a bullying situation. So, this is the kind of problem that we stumbled into about 8 years ago now, realising that if we keep examining this problem from the individual level, they're going to keep getting the same results. We need to start attacking the problem at the organisational level. So looking at those systemic factors, how we can address this across the organisation. And this is backed up from some very clear research. So the work environment hypothesis as a source of workplace bullying, the work environment as a source of bullying is a very established framework in the literature, was put forth in 1994, so, coming up on 30 years ago from some Norwegian scholars. And what they hypothesised is that the work environment is what which stipulates all of the characteristics of the organisation, psychosocial work environment, is what causes job stress and job dissatisfaction. And from there, we lead to perceptions of bullying and harassment. So when workers experience role conflict, ambiguity, insecurity in their role, or experience high levels of cognitive demand and workload, they also experience heightened levels of stress and dissatisfaction over time, which leads to bullying. And these are actually the strongest predictors of workplace bullying within an organisation. So again, various meta-analyses have shown that these organisational systemic level factors of bullying, strongest predictors, much more so than any individual level characteristic in terms of gender, age, tenure, anything like that. And that's been consistently sustained over a number of studies in the years. So we sought to, as I said, take a new view of this problem, and that is to see bullying and things like stress and strain, absenteeism as the tip of the iceberg. It's what shows up in organisations, it's above the surface, and it's what we can measure. But it's not really the full story. What's going on below the surface is poor work environment systems, practices, procedures that underpin what's, the consequences here. So this is the level of intervention and prevention that we need to focus on. These are the root causes of bullying. So, that's, again, this is just sort of how we starting to reframe the problem. We're starting to see this come through in the literature now as well. The issue we're seeing is that translation into practice. So we do still see a lot of practitioners and consultants coming into organisations saying, let's just develop a policy and let's have posters and let's have, nice get-togethers and morning tea, and that will totally solve the problem. Actually, it's a really deep-rooted problem, and it requires quite a systematic and engaged approach to tackle the issue. So our approach really aligns with a general psychosocial risk management approach, which is set out for the management of, all hazards, physical and psychosocial. So this is the Safe Work Australia framework. The identification of hazards, this is pretty well done. We have lots of tools that enable us to measure those sorts of things. The issue in previous years has been assessing the risk. So identifying where the risk comes from that allows these kind of psychosocial hazards to emerge. Now, thankfully, that's been addressed very recently. We've now got 2 validated risk assessment tools in Australia, one being the People at Work tool, which was developed by the various health and safety bodies across Australia. So WorkSafe, I think it was led by WorkSafe Queensland, and with support from all of them. What the People at Work tool does, it's a free resource, so it's great for organisations that don't have a lot of resources to invest in this, but it enables them to identify, some of the underpinning in terms of what might be addressing. Sorry, not explaining this very well. It identifies things like, cognitive and emotional and physical demands. So those are the sorts of things that underpin bullying. And from there, if you've got skilled facilitators or, people in the organisation, they might be able to consult with the literature and identify how we're going to reduce those kinds of physical and organisational demands, that sort of thing. What our tool does is really tap into the aspects of the organisational system where those sorts of demands are likely to rise from. So we can also measure what kind of demands are being experienced, but we can also pinpoint that that they're most likely to arise in the way that people's workload is being managed, or how they're being trained and developed, or how the rostering system has been set up, or how their leave and entitlements are being administered. So it goes to an even deeper level to, as I said, to pinpoint where the point of stress is, where the pain point is for that organisational team or unit, and they can make changes to their systems from there. So that sort of process has been developed over quite a number of studies now. Our initial steps were to develop the framework. So that was analysis of real-life bullying complaints lodged with Safe Work South Australia between 2010 and 2013. They make for very interesting reading. I've just finished recoding all of those cases again for some other work, and you get some very interesting accounts of, how people have interacted. Some cases had as few as 10 pages, some up to 500 pages, but it allowed us quite a comprehensive data set, to work from, to identify where was the source of the bullying that led them to escalate this matter to Safe Work SA. And what we found, I'm just going to move, just move that over there. What we found was that in 90% of cases, the bullying was really stemming from the management of coordination and people and tasks. So this idea that bullying is sort of slandering people and writing on their Facebook wall and, teasing them, there were elements of that there, but the vast majority of what was occurring, the bullying behaviour, lied in the way that work was being conducted. So this was further split into the three, what we call the three job domains. So coordinating and administrating working hours. So, pretty self-explanatory. So I'm just trying to find the numbers. Is that one? Nope, I don't have them. That was about 46% of cases. It was what we sort of coded exhaustively, so it wasn't exclusive. Managing work performance presented in 86% of cases, and particularly managing underperformance showed up in about 45% of cases that had been escalated. So this is a real crux point for organisations in terms of that perception of bullying and harassment. And shaping relationships in the work environment was about 65%. So how, team relationships were being handled, how mental health and general wellbeing were addressed, and physical safety hazards. That tends to be an area of strength for organisations. We've done a number of these studies now, and that almost exclusively shows up being in a low risk category. So organisations are pretty good at, handling tripping hazards and manual handling and all of that, and really not so good at these things up here. So training and development, appraising and rewarding job performance, tasks and workload. There's sort of the three main areas of work design that we see come up most consistently. And so obviously risk management efforts need to target these areas rather than taking an individual approach. We examine the processes, procedures, systems that underpin these areas of work design, and we try and make them more effective and sustainable. To do that, we've created a suite of practical tools. So our key tool is in the risk audit tool itself, which is sort of a series of 10 behaviourally anchored rating scales, aligning with those sort of areas of areas of work design. So we ask participants to give an overall rating of how effectively those areas of work design are managed and coordinated. We get them to indicate some of the most common behaviours, good and bad, that they see in that area of work design, and then we allow them to comment on that further if they want to, provide further context. That's both in electronic and paper format. We also have shorter versions of the tool. These have primarily been used in a regulatory context, so by Safe Work New South Wales, Safe Work SA, and what that does is enable them to go out and just get a very an evidence-based, but a very quick assessment of the risk of health, risk to health and safety arising from psychosocial hazards. If they find from these checklist tools that there is the potential for risk there, they go back and administer the full risk audit tool. And again, they can provide that same information that the key source of bullying in their organisation likely arises in these points in the organisational system. So our approach was to developing these tools was to revisit those 342 complaints. In addition, we conducted 44 critical incident interviews, primarily with people in health and health and community services and education, because that's where those industries are where the bullying presents most commonly. And we identified the key indicators for each of those areas of healthy work design. So identifying the indicators, we then sorted and rated them into those behaviourally anchored rating scales. So in phase one, we had 159 indicators within what is now 10 job activity domains. We maintained indicators that were correctly sorted into their original job activity domain 70% of the time. So we wanted to make sure the behaviours that we thought were reflective of these areas of work design, others sort of saw that as well. So this is sort of what it looks like. These are the kinds of indicators for something like clarifying, defining and assigning job roles. And we then went on to sort and rate the indicators. So once we had established that these behaviours were reflective of that particular job domain, then we sought to position them on the behaviourally anchored rating scale according to how effective or ineffective they were. So we had people, again, rate that kind of thing. We had 3,602 ratings. And I think in that instance, we retained they had to have about a 60 or 70% agreement rating in order for it to be retained. So we lost a few at that, about 8 at that point, because they were being rated too inconsistently for participants. Then went on to validate the framework and the tools. So we did this on in conjunction with a larger study of psychosocial work environment that was being conducted at the time, an outcome evaluation in 25 hospital wards down in SA with 212 employees. We collected 3 sources of data, so current exposure to workplace bullying, different measures of what the known risk factors for bullying, so ambiguity, conflict, clarity, and then also some objective data around, so taken directly from the organisation, around patient safety, work injuries, absenteeism, that sort of thing. And that was all sort of collated via this self-report survey, and then obviously this from the organisational databases. What we found was that at the team level or the ward level in this study, the risk audit tool could discriminate against high, medium and low risk hospital wards based on that independent data. So based on, again, patient safety, worker injuries and absenteeism, we could identify which wards were most at risk of workplace bullying, and that corresponded with their, their scores of bullying as well. And it also allowed us to establish the risk of bullying above and beyond these kinds of traditional risk factors that have been established in the literature. We've since gone on to evaluate those tools in practice, and this is primarily the basis of the research work that I do now. We've taken the tool and launched it out into a full intervention process. So we always start with diagnosis using the risk audit tool and other data sources, either from the organisation or, as I said, a number of other psychosocial measures that we might want to pick up. Things like psychosocial safety, climate is often there, violence, workplace respect, job engagement, all of that sort of thing. And we graph it out in a way that shows us the sort of organisational risk profile. So this was data from an organisation with 10 sites here in Queensland, and you can see that there's a very clear trend across those sites, despite being hundreds of kilometres away from one another and having totally different management teams within those sites, because they're all responding to the organisational level approach of, how to set workloads and appraise and reward workers and that sort of thing. As I said, we almost consistently see this upward tick around maintaining a safe work environment, and then this left side of the graph is almost consistently low. So organisations have a lot of trouble in setting up systems for task and workload, appraising, rewarding job performance, and training and development that are effective and healthy for workers. Once we have this risk profile, we go back to the organisations, and with a representative sample of the team or unit or whoever we're working with, we implement a 3.5-hour co-design workshop. We present the results, and then we get them to unpack what's currently happening in those areas of work design. So how are workers currently appraised and rewarded for their work? How are tasks and workload allocated? How is underperformance managed? All of those sorts of things. And then on the flip side, we get them to identify new ways of, managing and coordinating those areas. So we have, as I said, it's a representative sample. We have frontline workers, senior management, everyone in between, those who've been there a while, those who are quite new to the organisation, to get a really clear perspective about how, those procedures are being received by the organisation. And there's obviously quite a lot of clash between management and employees. Sometimes practices that management think are going really well have actually been really poorly received by employees. This is the kind of feedback that we get from those workshops. We've had employees sitting across from senior management, not out of the trauma of it, but just from the sense of being able to share their experiences of how things are actually been running. They've never had the opportunity to be upfront with their senior management and share what they think could be done better, and how it's really affecting them. So it's quite they always come in very sceptical. It's quite funny to see their transition. You can't shut them up by the end of the workshop. But they do report the experience itself to be really valuable, and they go on to become our supportive workplace champions. So they support the senior management in implementing changes that are identified in the workshops. So some of the strategies are, things around being able to go to other areas of the organisation, so that role development and promotion, having more support around training and development, being afforded opportunities that maybe only some people were allowed to do before, and having more, one-on-one feedback, that sort of thing. It just depends on the areas of work design that are identified in that initial risk audit survey. Just to say as well, some strategies are what we deem quick wins. So they're things that can be implemented relatively quickly off the bat within 90 days. They don't require a lot of resourcing and time. Could be things as simple as ensuring that management actually get on the floor and say thank you to employees as they're finishing up their shift. Some strategies require quite an extensive reformatting or resetting up of a system, that sort of thing, and that can obviously take a number of months or years, and so that's all written into the action plan, and we work with the organisation to support them all the way through. At the end, we seek to evaluate through intervention, re-administering the survey, stakeholder interviews and various outcome measures. We're just starting to get some of that objective data in now, because it often takes quite a while for us to come back and resurvey. They have to be able to make the changes before we can actually see, the flow on effects to bullying and that. But we've done some work with correctional services in New South Wales back in 2019, and they reported to us earlier this year that following the workshops, and they did a great job in implementing a number of strategies, they noted a 29% decrease in absenteeism rates off the back of 3 years of baseline data. So that's the equivalent of about 300 working hours, a couple of $100,000. They noted that the culture had shifted significantly, that there were a lot of people willing to come back to areas of the facility where they had just flat out said that they wouldn't go back to before. I couldn't include it in here because we're being recorded, but we've got some really fantastic data coming in from one of our other organisations that's shown over a 9-month period about a 25% decrease in workplace bullying, quite a significant drop in perceptions of job demands, particularly around physical and cognitive demands. Emotional demands, we didn't see a lot of change. We didn't really expect to, because that was over the COVID period. So between October last year and June this year, there's been a lot of stress and strain there. We did see a small drop, just not significant, but we saw a lot of other positive changes. Importantly, what we saw is in those 10 sites, even though the changes were small, statistically significant, but smaller effect sizes, they were the only 10 sites in the zone that reported those drops. All of the other sites reported massive increases in demands, in complaints, escalation to their, national team, that sort of thing. So this process was sort of seen as kind of a protective factor, especially in these times of, transition and stress in the organisation. So that was really encouraging to hear. We're currently running a randomised control trial with the organisation. So we've got 30 sites who have gone through this intervention process. We're just getting the data in today. Would have liked to have shared it today, but they kept pushing the survey out, unfortunately. And we feel very confident that, again, compared to business as usual, we'll see some really excellent changes in those particular sites in terms of practices and flow on effects for individuals. So this is, sort of a bit of an overview of how those tools have been evaluated in practice. We're growing all of the time. We're starting to branch into higher education. So that's, we're starting to see reach there. It's obviously a time and resource intensive process. It's not for all organisations, you know, it's not for your fish and chip shop down the road with only 5 employees, but for those major organisations that really need to move the needle on this issue, we found it to be highly effective and positive. And that's about it.